Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how I scan the radial nerve starting on the humerus. We know the radial nerve comes from about the posterior shoulder around to the lateral aspect of the humerus. So I start my probe, start with my patient, supine, with their humerus in some internal rotation. The orientation of the probe is transverse, with the landmark being about the midshaft of the humerus. The movements are going to be angling like so, and distal until we can see that nice, bright, white, circular radial nerve sitting just superficial to the humerus. We then can follow the radius distal until it starts to bifurcate, and one branch comes posteriorly, and one branch comes a little bit more anteriorly. So these are the motions that we make following the radial nerve from the humerus into the forearm. I'm going to show you how to scan and inject the superficial radial nerve in the anterior forearm. Much like scanning the median nerve, we start with enough depth to find the two bones of the forearm. We can see the median nerve directly in the center of the screen, and off to the right of the screen we can see the pulsing radial artery. Immediately next to that is the superficial radial nerve. Remember, the posterior radial nerve has split approximately here and come quite dorsal in the dorsal forearm. If I now reduce my depth, I'll turn on the yellow arrow and point at the radial artery and the superficial branch of the radial nerve. If I now get that in the center of the screen, we can slide the probe distally, keeping the superficial radial nerve here. And if I were to inject this, I could simply place my needle here and come radial to ulnar, or I could continue scanning distally. I'll turn that off, reduce my depth, turn on the zoom so you can see it better. There's the superficial radial nerve there, and we can continue following it distally. There it is there. I'll pronate the hand just a touch. And we now see the superficial radial nerve comes quite dorsal to provide sensory innervation to the dorsal hand. And we could inject any place we like where we think the nerve may be entrapped. And that's how we scan and inject the superficial radial nerve.